Dealing with chronic headaches that never seem to go away, tried treatments and medications that never produce long term pain relief. This video goes over some of the most common and most fixable causes of chronic headaches that most providers completely miss. Nothing is worse than when someone is having, a great day and out of nowhere, a nasty tension headache or migraine kicks in and the whole day is ruined. They rush home to pop a few meds and get into a dark room before it goes full blown, can't do nothing mode. So many people, unfortunately, suffer from chronic headaches for a really simple reason. They've never been properly diagnosed, and you can't fix a problem if you don't know what it is in the first place. There are two types of headaches. There's tension and migraines, and they're not the same. So what causes tension headaches? So this photo here is a picture of a little tiny nerve that runs in the back of the head. It's called the greater occipital nerve. And basically what happens is it starts right about the C3, C2 level in the neck and then goes all the way up into the base of the skull. And over time, with bad posture, stress, everything like that, all the muscles around the nerve, they develop this stuff called adhesion, also known as scar tissue. And eventually it does get stuck to that nerve. And when it gets stuck to the nerve gets really irritated, really angry, lots of inflammation, and triggers those type of tension like headaches. So the way we treat it is first we got to find it. And that starts with a very detailed examination and palpation. And once we do find it, nerves are very special. They don't want a lot of pressure on them. They want just the right amount of treatment. So we get proper depth and tension. We're able to actually break down all of that nerve entrapment and allow blood flow, oxygen, everything to perform better. And it takes the pressure off the area and actually gets for long lasting relief for tension headaches. Now, the other cause of headaches is migraines. Now, migraines are different than tension headaches. And where they usually start are in these deep muscles in the neck. They're called the suboccipitals. They're right up against the spine and the base of the skull. And over time, again, with bad posture, stress, being stuck at a desk, looking at a phone too long, those muscles also develop a lot of that adhesion and that glue. And when they get angry, they start to trigger a migraine-like symptom where it'll have a pattern where maybe it goes up the head into the back of the eye and everything like that. Now, these muscles are really deep. They're hard to get to. So a lot of times when we treat them, we have to go very focused, very intentional with our treatment and break that down. So these are the two types of headaches that people can have, and knowing which they are and what is causing the problem is very important. So chronic headaches don't have to be something that you just have to live with or resort to dangerous surgeries and injections. Our providers take a new treatment approach that helps identify the root cause of the issue and have the skills to help produce long-lasting tension headache relief. So if you've been dealing with chronic headaches for at least 6 months, you've tried lots of different treatments with different providers, then you're eligible for a no-charge consultation with one of our dedicated providers to get some real answers about what is going on and on the path to long-lasting pain relief.